Okay, so again, good evening to everyone. We will have our synchronous session for the nursing informatics. But before we start with our discussion, we'll have some recap or review of our topics that was discussed last week. The floor is open. The virtual floor is open for any questions and clarifications on what we have discussed last time. Last time we had the discussion of the basic concepts, and most of the responses that you have shared is related to the concepts of nursing, which eventually consider that the core of the concepts of nursing is on the caring and the holistic, care management to our client, which eventually we have connected it with the concept pertaining to the informatics. And it was concluded that the highlighted term or words that had been associated with informatics is technology. And we have connected the concepts of nursing and technology as well as an innovation on how we will discharge the performance of our responsibilities, by which it considered on how the healthcare industry, the healthcare settings, the healthcare personnel definitely benefited from the perspective or from the principles of the use of technology, uh, even during the public health emergency. Next, we have also discussed the introduction of the health informatics on what are the importance and principles of science of data, information, and knowledge. And we have defined before that the data as a general term that may not have a meaning, and information are are those that may have specific meaning, and the knowledge is are terms or words that are used eventually with evidence-based references. So we have set examples during the time that we discussed data, information, and knowledge, and this could be elaborated as well on the next topic, because the next topic that we will consider is to give more emphasis of what data, information, and knowledge is. We have also discussed the, the we have also integrated the audiovisual presentation of what healthcare informatics is, and we have defined the healthcare informatics as well as on the use of the computer and the information science, by which it considered the the use of the computer for the storage, for the retrieval, for the access of the information. While we have considered the information science on how it processes its analysis and how it benefited as well to 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 give us the idea on how we will use this and maximize these concepts to provide efficient and quality care management. So in healthcare informatics, we have discussed also by the QSEN 2003 that these are the use of the information and technologies basically to communicate. So we have set an example that in the communication, even the healthcare personnel and the patients benefited from it because they can communicate using the various platforms, applications, and gadgets. Even the they are not physically present with each other for interaction, but they can use the various platforms to still have the interactions and exchange of informations and messages in relation to the health the status of the patients, or the health information that had been accessed by the healthcare team. We have considered also health informatics as to manage knowledge, simply because this really considered the guidance on how we will validate information, on how we consider that the the information that had been accessed is based from the evidences and scientifically analyzed. Health informatics have been also reiterated the use of this principle to mitigate the error. Mitigating error is definitely preventing the errors, because documents itself, the access itself, timely response as well can consider also as part of the efficient records management, because if we will retrieve those information, it could be stored already in a system that can be accessed by any authorized healthcare personnel. Thus, if, for example, if a patient had been hospitalized before and readmitted as well, we will not anymore browse to the records section, the medical records of the patient. However, this could be used through the health info, rather the hospital information system. Next, in healthcare informatics, it support also decision making. The clinical decision making among the healthcare team, specifically the nurses, will will basically consider those baseline information, just like for example, if there are vital signs that had been recorded in the previous shift, can still be accessed by our healthcare team or personnel so that it can support the holistic approach or the care plan or care management of the patients. We have also discussed health informatics as revolutionizing the practice. The revolutionizing means that this consider the purpose of the use of technology and the use of the computer when it comes to how we dealt with the restrictions and limitations on the delivery of care to the beneficiaries of the care management. But indeed, this not hindered us to consider po the delivery of these services, because the revolution itself is also the evolution on how it considered the advantages of using this informatics, and it really improved not just only individuals but also the entire population. It has been reiterated as well that in nursing, it considered uh, the population groups across the lifespan and in varied settings. So we have discussed also the principles of computer and information science on the four areas. So we have considered also advancement of life sciences and research, because advancement of life sciences through research, evidence-based practice, clinical decision making have provided us an information on how we will prepare the future. Since we are aware, for example, of the last years or the last 2 years of the pandemic, we have already stored basic information and studies, research findings that are related to the COVID-19 infection. Basically, in the use of the vaccines to consider this as a uh, prevention of in being infected by the COVID-19 virus. So with these studies, this could be accessed through the literatures and through the use of the search engines, through the use of the storage of information, the clouds, and even access to the legitimate websites. We can uh, prove, or we can evidently consider that our actions now in relation to our attendance to cases with COVID-19 may consider quality, because it can lead it leaded to the basis of evidences. We've considered number two, health professions educations, because one of the principles of computer information science have benefited the nursing education more over in nursing schools. So we have set also examples also, not just only in nursing schools, but it benefited also how our professional nurses can still continue to attend trainings, webinars through continuing professional developments, and through the use of applications, through the use of the Department of Health Department of Health e-Academy, and various webinars that translated into the access, even though the professional nurses are in active duty, but they could still access on these trainings, even though they may not anymore proceed to the physical facilities where the seminar or the webinar is being held. Third, the public health benefited from the health informatics on the use of computer information science. First and foremost, during the time of pandemic, we set an example related to the tracking device, the tracking application, where nurses had considered the use and maximization of the use of these resources. Moreover, it may prevent more exposure for nurses, and at the same time it can translate efficient access of the information for the immediate alert of the concerned communities, families, or individuals. Fourth, most that definitely considered as the core beneficiary of care for purposes of safety, or our intention of having a highest priority of safety, patient care. So use of electronic health records, use of electronic medical records, use of access to the health information system, these are these are the benefits on how the patient care have benefited from the use of the computer in information science. And since we have mentioned as a review in the health informatics, we have considered the focus on health information technologies. So if we say health information technologies, it involves the use of computer, cognitive, and social sciences. The computer itself, considered as the storage, it process retrieval, it process the access of the information. While in the cognitive, the information that had been learned by an individual have served as his way on how to process clinical decision making and how to process efficient and effective decision making for the patients. Third, social sciences have been integrated in health information technologies because of collaborative network. We have maximized the healthcare team as well on how we can timely and or may have real time access to the basic information of the basic information of the patient that will facilitate timely care management, lalo na in the case of emergency situations. Next, we have also considered the benefits of the health informatics. It considered po the improvement individually by patient on the clinical level by hospitals. Okay, this facilitated prevention of complications of patients because of the access of information, because of results can be accessed easily, fast services can be rendered to the patients, even though some of the healthcare team are not present physically in the hospital. Two, it improved from individual to the population. The population uh, really benefited from it. It's even across the regions because of the geographical differences or challenges that we have in the country, but still the use of the health informatics provided us benefits on the access of information so that um, to release or to issue advisories for the concerned individuals. And last is to enable health organizations. So various health organizations, the DOH, World Health Organization, United Nations, and even local professional organizations such as the Philippine Nurses Association have benefited from health informatics because it identify a network or a venue for us to facilitate consolidation of this information and translate it as a reference for purposes of a more useful and more meaningful uh, use of this information for the benefit of our patients. Now, let's have our interactive session. Since we have already discussed the basic foundations and principles of the informatics or health informatics, there will be there are no wrong answers in our activity for today, interactive session for today. You may now access the slido.com 357-9619. The question is, what healthcare settings will consider topmost priority to establish health informatics? And later on, we'll explore on your responses and you may share your insights why you have responded to these choices. Okay, so each one of you can only choose one so that it can facilitate and maximize your participation. So okay, let us start with your responses. Again, what healthcare setting will consider topmost priority to establish health informatics? So eventually, all of these healthcare settings or agencies really considered significance and importance of establishing health informatics. But let us explore of what are those areas by which it will need a priority. Just a tip, just for example, if you will be the Secretary of Health, if you will be the city health officer of your locality, if you will be a public servant, and you will be given the opportunity and privilege to allocate fundings. Okay, to allocate fundings for the those agencies that are present in your locality. or not just in locality, but how your local government unit is connected to the national offices. So what are those choices? So we may have public health. So we have rural and urban health centers or city health offices. It could be clinical, uh, hospitals and specialty facility. So pag sinabi natin mga specialty facility, ito yung mga Philippine Heart Center for Cardiovascular, National Kidney and Transplant Institute for kidney problems, and Lazaro Hospital for infectious and communicable diseases. Government agencies, Department of Health, so we have the Professional Regulation Commission and the OST, and nursing education, schools, and training facilities. So with our responses, let us check. With our responses, uh, please have the others po participate because your response are very important and it will facilitate uh, exploration of how we respond accordingly on prioritization. Kasi we have already identified that nursing informatics are very important nowadays in our healthcare system. But if you will be in the position, if you will be given an authority to allocate funds, to establish allocation allocation for funding for health informatics, which of the following will you consider as a priority establishment for to fund to have a priority funding for health informatics? So it seems 75% of the your responses are in the published health. Clinical hospitals and specialty clinic are in the 18% of the responses, and government agencies, DOH, PRSC for 6%, and no response for nursing education. So still continue your responses, but probably randomly I may ask anyone in the group of your responses, and you may state briefly your reason why you have chosen the specific facility. Can I call on Miss Shera Pere? Miss Pere, you can.
Good afternoon,
Yan,
Ria.
Miss Pere, what is your response on the establishment or healthcare setting that basically consider a priority for funding or priority to establish health informatics as infrastructure?
Did I answer clinical po, yung hospital and specialty facility po? Kasi
Okay. Yes.
for me po, clinical informatics po kasi ano po pwede po siya mag-promote ng patient-centered care, and kapag po kasi mas may experience sa hospital, parang sabi na kasi nasa hospital tayo, may sharing po with doctors and other healthcare providers which is important para
Okay.
mas accurate yung data.
Okay, that's good. That's a good response. So to have a follow-up response to your reason is definitely correct because it will facilitate efficient services to our patients on the access of data, and you have mentioned also that it will consider access for the healthcare team. Thank you very much, Ms. Shera. So I may call other students also. Can I call Mr. Escobar? Ayan, Mr. Escobar, Edison. Edison, what is your answer on the question that we have? What is your answer? Mr. Escobar? Okay, so probably he may have problems and difficulties with his connectivity. So probably you may turn on your audio if ever you are already available, Mr. Escobar. So let us now proceed with the others. How about Mr. Clemente? Prince, what is your
Good
response?
afternoon.
Good
My,
afternoon.
my response po is yung public health, rural and urban health centers was city health offices po. The reason why I chose it po, kasi po, I feel like nursing education, government agencies, and clinical hospitals and specialty facilities has already used po modern technology, they adapted po. But with public health po and rural and urban po, most of the time po, I see po na puro pa rin po sila paperworks. And
Mm.
sometimes po parang mas overloading, mas madali pong mag-load po yung data if ever we give po the public health, pati itong mga rural and urban health centers po, a chance po with this modern technology po, so that para mas madali din po mag-gather and data and ma-establish po yung mga datang makukuha.
Yeah, correct. Very correct ang iyong response kasi I agree with you. Actually you responded according to your observations, and that is very true. In the public health and in the most rural health units, if ever you observe, for example, you will seek primary basic care services, and your information or your profile will be retrieved. It's still manual, and it takes time how they retrieve your profile, and the processes itself takes time because they still need to access in their filing cabinet the files that they may need for the doctors to attend to your needs. So those observations are very good basis and reference for your response. I have seen a raised hand. Miss Era Pegarido, you are recognized.
Hello,
Miss
good evening
Era,
po din.
good evening.
Yes po.
Yes.
I think po for me if public health also kasi ang primary task nila is um pub to report kung ano yung mga case to case
Mm.
basis on the areas na pinagwo-workan nila. Geographical analysis also very important yung information system dyan. And of course sila yung nagde-detect, sila yung first line of defense natin. For example, kapag meron tayong, for example na lang po sa COVID, very
Mhm.
important yung data analysis natin doon. And also sa AIDS na din, sila yung pinakaunang humaharap sa mga patients natin. So sa kanila po magiging pinaka um, beneficial yung health informatics na ma-establish.
Ah,
Ayun po.
thank you so much, Miss Pegarido. Uh, that is very true kasi we are considering promotive and preventive management. And I think the reports that can be generated on a primary level is very important to mitigate a spread of any infectious or communicable disease. So in general, the majority of the public are being protected if you can access easily and efficiently those data. And this will definitely be cascaded to the appropriate agencies as well, di ba? So that it will already facilitate an initiative that will support the prevention in a certain locality, barangay, or areas that are very significant, that is very significant due to the scarcity of resources. And very good observations. I have seen a raised hand po. Richmond De Leon, you're acknowledged.
Good evening, Tit.
Good evening.
I want to add lang din po. Yung answer ko dyan is public health. So why public health po? Because going back po on what we tackled sa CHN po, going back to the purpose of public health, it prevent po the disease outbreaks po and minimize the spread po. So by having or by establishing health informatics po sa public health, yun nga po, it can yung mako-combat po niya yung or mape-prevent po niya yung health problems, even po yung mga problems which are smallest po, lalo na po doon sa mga most isolated communities po sa atin po. Yun.
Very good observation. Outbreaks, because the timely declaration of outbreaks are very important kasi it will always depend on numbers. So that's why there are questions that are being raised now in the healthcare communities. If are we going na to declare pandemic to endemic? Kasi the pandemic is worldwide, must definitely broad yung coverage. If we will try to consider the endemic, it will just only identify regions or areas that have high cases of COVID-19 or outbreaks. So the basic information that are needed so that there will be a sound and harmonized decision is through data and information. Rather, it's information because it already answered those that are needed. It's data. So those information that will be provided will be useful. That's why I can even share with you. Last week we have we had the consultation in the Senate on the comprehensive nursing bill, and the basic information. Moreover, in the public health, rural and urban health centers are very important because it facilitates the ratio, or it give us the information of the number of population groups affected by a certain outbreak, communicable diseases, parasitic diseases, and and it's a factor that there must be a nurse in every barangay. And it's shown that based from those cases, those areas that had been identified do have insufficient manpower such as nurses. So it's very powerful that once you establish this health informatics or system in the healthcare settings of rural and urban health centers, it could be very beneficial. Just like, for example, if a pregnant mother who lives in Zamboanga and will have her normal spontaneous delivery here in the Pabelia, how the doctor, there will be two different doctors who attended the patients. The doctor who attended in the health center in Zamboanga, and the one who will attend to her in Pabelia Hospital. So how these doctors will have an harmonized information so that to identify the appropriate treatment that will be given to the patient. Example, if the patient is unconscious, if the patient is not cannot comprehend the situation to respond. So that is merely one problem. If there will be, if the patient has no accompanying individuals to respond to the questions of the doctors, these are some constraints by which it delays the delivery of healthcare to our patients. If the patient or the pregnant mother is on high risk, then basic information are very important. And the patient probably do not have those documents, enough documents for her for the doctors to validate her history on the 9 months consultation that the patient have, and in her situation during the time that he was considered as on the high risk pregnancy. So I think if we have an established health informatics system in the rural and urban health centers, the doctors in the hospital, such as the clinical, can access those information already coming from the rural health units. It may take time din kasi yung pag-interview because yun nga, it may set limitations depending on the consciousness and alertness of the patient. So for us to have the more accurate way and efficient way of managing the patient's condition, I think this could be a way of how we can retrieve those information and will be beneficial for the patient. Before, if you have heard about RX box, RX box was established for purposes of the healthcare informatics system for the health centers. But since on a political and economical, socio-economic perspective, this did not pursue due to the lack of funding. So that is why that's one also of the barriers and hindrances and factors as well of why this has not pursued. This has been not lobbied for the continuation of the implementation as well. So it did not pursue the use of this RX box that will facilitate access of information from rural health unit going across to all healthcare facilities. So probably I may ask another one from the group on your responses. So I may ask po randomly, can I ask po Miss Jelly Courtney, Helly rather. Courtney, are you on your good connectivity? Miss Coro? Okay, so we'll go back to Miss Coro. How about, ayan, Miss Jennifer? Okay, can
Yes, hello
I,
po din. Good evening po.
good
So,
evening.
yeah, I chose din po yung public health as what my classmate said nga po, yung important po talaga yung collecting data mas ma-improve pa po sa ating mga health centers because yung vital na nursing processes yung documentation is napaka-importante po sa atin para malaman natin kung ano yung mga susunod pa nating gagawin para sa ating mga kliyente or pasyente sa community po.
And thank you, Miss Coro. Kasi I do understand your response. That is very important for future projects. Kasi if we have established issues, rather if we have encountered issues and challenges on the level of the public health, then this could be, even though it be the change of leadership of officials, at least they have already established the records and information that are needed if it will consider pa rin as an advocacy of these officials to pursue a definite solution on this problem. So I think this could be the reference for initiatives if we are having a data-driven system in the public health. Thank you so much, Ms. Coro. Probably last one for the response, but seeing your responses, some of you have already considered nursing education. 5%, government agencies 10%, 14% for clinical and hospitals, and the highest on the consideration for the prioritization is the public health. I just want to read in the chat box what ask ko lang po if PhilHealth po ba is under government agency. Yes po. So I think PhilHealth could be one na may be considered for government agencies kasi this will facilitate, di ba, na yung mga online applications. So just to give you a basic information, before, when a patient is admitted in the hospital will furnish you a copy of a form, a printed form. So the patients or the relatives will fill out the form, and submit it not to the hospital, submit it to the PhilHealth office. And once it will be cleared by the PhilHealth office, then it will have the response to the hospital via courier pa or by hand carry of the patient's relative. So it really took time on the processing because again, a long queue are expected in these agencies. So the processing itself of the PhilHealth benefits will be longer as the usual that we expected if the PhilHealth will really establish a strong health informatics system or informatics system. So yes, PhilHealth. But for the SSS, it's a private for the private entity. But I think that is one that I miss as part of the choices. Private agencies also, di ba? Such as the SSS and other agencies that has an equal importance also on our healthcare system or processes and procedures. Next, last one that I may ask for their input. Can I ask for Carlo? Okay, Mr. Gakad, are you with us? Mr. Gakad? Carlo? Okay, you have a concern with your mic. Thank you. Okay, ayan. So I'll just read. Ask ko din po a question kasi importante yung data lalo na po sa rural area. Specifically sa probinsya, malayo po sa kabayanan, maunti po ang mga gamit nila and medyo kailangan pong pagtuunan ng pansin. Correct. Kasi 'di ba? Thank you. I will acknowledge the input of Ms. Lira and Sina. This is correct. Very good observation, and this happened to me even before when I work in a private hospital and wherein the patient will be transferred to a government healthcare institution. The problem is that we need to coordinate primarily to the healthcare institution and process all those documents that can be accessed by the hospital, the physical, the printed copies. So if this could be the concern in and the situation goes that the patient will really need to transfer already to the healthcare facility, the health informatics can be useful to the extent that the patient can start transferring to the other hospital while the hospital is still processing it through the use of an established information system, and may benefit as well the connection to the hospital as a timely access even though the patient is not yet transferred in the hospital. So I think the access itself may give an overview to the healthcare personnel, emergency room nurses, and the physicians on the condition of the patient using these applications and using this information system. So that is correct. Because there are some instances also, eto na lang ha, uh, if there are medications or drugs that are not available in the hospital, then probably the patient will be asked to purchase it outside the hospital. So the next question is that of will the mentioned drug is available to the nearest hospitals in that community, in that locality. So I think it will be very hard for the patient's relative, himself or herself, to proceed to all those facilities and ask with no assurance that it is available. Unlike the use of the information system, it can already search or it can already have the access to coordinate the stocks of those medications or drug to these hospitals if it is available for purchase. At least it can save time, it can save also money because it can if it's already available in that particular institution, you can set your budget for your transportation, and as well as you can already uh, expect and be assured that the drug is available in that hospital or facility. Okay? Unlike you will a typical example na lang, if you purchase a drug in a Mercury drug hospital. So disclaimer, I'm not a promoter of Mercury drug, pero most naman for the drugstores and pharmaceutical institutions na available po most in all areas are Mercury drugs. So kung for example, the medication or drug to be administered to the patient is not available at the moment and you are asked to purchase it to the hospital and other hospitals or other branches of Mercury drug. So every Mercury drug, yung location niya is very distant with each other. So again, it will take time, and it will process eventually the 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 resources when it comes to finances. So at least if it could already identify and can track already what Mercury drug branches have the available drugs, then they could be advised accordingly to proceed directly to that branch of Mercury drug. And this is already in existence or already happening in their branches, because when for example you will inquire if this drug is available in that particular branch, you will be referred immediately to a particular branch because they can already access in their computers through their information system on the number of stocks and availability of stocks in every Mercury drug branches. So those are the benefits of the use of the information system in these institutions. But these are private agencies or establishment, which I missed to include in our interactive activity. So okay, for Mr. Gakad, so allow me to have your response. So same idea, public health po ang response ni Mr. Gakad. Thank you for still answering it in the chat box. And you have responded na kasi parang accident. Okay, yeah. This is one good example. When nagkaroon po ng accident, dati na 2 hours pa ang biyahe para lang madala sa hospital. Kaya I think need po talaga i-develop at pagtuunan ng pansin ang public health. Yeah. One of the concern din kasi natin in the public health is that of, for example, yun na nga, tama ka dyan. Yung hindi ka aware kung halimbawang may emergency, tapos yung hospital na yon ay full na pala ang capacity. This happened during the time of COVID-19, right? So kaya nagkaroon ng one hospital command ang Department of Health para mag-direct na to our stakeholders, to our people, so that they could already have basic information to know po if there is still open beds for accommodation or admission in that hospital. So that was the use of one hospital command. But during the emergency, this may cause a problem pa, lalo na, for example, emergency, you will reach the nearest hospital. Yung pala, they are in full capacity. Then you will transfer. Again, you will transfer to the other hospital, and yet no assurance as well if you will be admitted. Emergency situation na yun, ha? So those are some of the situations na time is really an element in attending to these concerns. Kasi kung, for example, if it is really an emergency, so the hospital can still attend, but they do not have the facility to accommodate the admission. So I think yung time itself to prevent complication, which is supposedly the patient have already been admitted to that establishment or hospital, is very important, because I think if the hospital that they will consider for admission have the complete services and facilities, this will prevent complications. Yun nga lang, if this will delay due to you do not have any individuals na access nyo for information, or somehow no assurance of your queries accordingly, that really will cause anxieties and pressure pa on the patient's relatives themselves. Kaya I think, and I do understand why you have answered 71%. Okay, another response that I recognize po dito ay kay Miss Galarido. So, health informatics pa rin po, you considered po in public health because it will be more organized and more efficient for staff. Since mas marami po silang magagawa with just minimal effort, kasi di ba minsan ang issue po sa amin sa public health institutions ay maraming patients. Correct. Correct. Kasi it is very important na, for example, sa primary care during the time of COVID-19, di ba isang patient lang during the time of COVID-19, we have this fear na maka-affect yan sa buong community kasi wala pang vaccine, wala pang treatment regimen that are being introduced for COVID-19 during those time. But at least with the use po sana of the information system, we can already identify yung mga mitigating measures for the families, kasi they are not allowed pa before, may mga lockdown, they are not allowed to be out of their homes. So how can they access to the healthcare personnel for the basic information that they might need? Another is, di ba, before we are very also particular, kung walang case yung barangay ninyo, i-check ninyo kung merong case yung nearby barangay, kasi it matters before. Kasi pag may one case yung isang barangay niyan, okay, we may prevent going to that barangay primarily because it already identified the case. But before kasi we don't have the system for the healthcare facilities such as rural health units and urban health units to access information and specifically identify the specific area. So sometimes there are, 'di ba, ang concern pa natin noon, may mga COVID-19 cases na asymptomatic but capable pa rin of spreading the infection. So yun yung mga basic information na sometimes during that time there is a stigma that when you visited the healthcare center, COVID-19 yan, may symptoms yan, baka may case. So those stigma, yun yung fear. But I think the use of the information system itself, if it is established, it can protect the identity of the patient, but the healthcare personnel will be aware on how to mitigate the spread of infection. So yun yung advantages. Okay, so thank you very much. I'm really impressed with your responses on how you use your analytical and critical thinking on the importance of why do we really need this health informatics in our system now. And I think the nurses have a major role when it comes to this perspective, it will be soon your advocacy. Yeah, that's why I'm challenging all of you that sooner or later, kung if you have noticed and observed that these are a problem and these are concerns in our community centers and city health offices, why not conceptualize your researches in the future that will cover and consider the use of health informatics and help our communities and have those solutions that will be very useful. We will not wait anymore for another public health emergency to have the solution, but rather we will consider more preventive measures through your research findings. Okay? So malay nyo, it will be funded pa by the DOST. So try to think of it. Try to think of it. And if ever you will conceptualize those concepts or those researches that you may have in the future in your third year level, I will be very much happy because I know that your research findings could benefit and can be utilized by the communities po. So thank you very much. So for our final survey, among our 27 students of N22, we have 71% of public and rural health, urban health centers, and city health offices that made really that must consider must be considered to establish health informatics a priority. Second is we have the clinical, hospitals, and specialty facility. Third, with the 10% of government agencies, and the nursing education, we have 5%. So humabol, humantay on the second rank. So we have government agencies for the 14%. I'm also taking into account your responses. So may nag-change ng response from 68% bumaba siya sa government agencies. Anyway, from the slido.com, I can access naman po those who have responded and so that I can also monitor your participation. But I do understand for the others who may not pursue or who may not send their responses due to connectivity. I do understand. What matters most now is we are learning from each other. Okay, so with this productive discussion that we have, let us now proceed with the health informatics. In every hospital now, if we have the Data Privacy Act, every institution must have the data privacy officer because it is mandated by the Data Privacy Act. But for now, um, uh, nurse informaticists is not yet established as a specialization here in the Philippines because we don't have yet a career progression pathway by which it will identify specialization of nurses. And that is one that has been considered as a provision of our comprehensive nursing bill to have advanced practice nursing here in the Philippines. And one of which that are being considered is this area in health informatics, by which it will identify nurses as having specializations on how it will contribute as well on the efficiency of healthcare services within the barangays, communities, localities, and even in the national level. So let us have first the difference between nursing informatics and clinical informatics. Okay, when we talk about nursing informatics, the tasks that are being considered here are more focused on patient care, direct patient care. Because remember, most of the nurses stays at the bedside, monitors the patient, unlike other professions. Okay? And recording and documentation are very important skills that are expected to be considered for a professional nurse. And in nursing informatics, this is uh, this is a more collaborative uh, role or task in coordination with the use of the health information technology system. Just like in the hospital, we have hospital information system. Whatever that are being done to our patients are being recorded as well. Whatever symptoms or alarming symptoms that the patient manifested, the nurse must definitely have it recorded. And who may access those records? Those authorized personnel, healthcare personnel who are in charge of the patient's treatment regimen. Doctors, pwedeng nutritionists, uh, doctors with specializations, And do the accounting department will have also the access to the nursing informatics? Yes, because the nurses are the ones who are responsible for the use of resources in every procedures or in any procedures that you have performed to the patient. Let's face it, hospital is still a business, and we need to take into consideration the sustainability of its operation matters with the resources that are being used. And this is also a basis on how to control and have the uh, complete inventory of stocks of the hospital. Because if the nurse will not declare that those resources are being used and we already lack those resources, eventually it may cause a delay in the delivery of healthcare services to those patients who may have similar situations or diagnosis. So that's why if we say nursing informatics, it is on the nurse who are using the IT system, and at the same time on the perspective on how it will focus on patient care management, on records management, on documentation, and on how the nurse facilitate the all the resources that have been used for every procedures that you have done to your patients. For clinical informatics, the clinical informatics is more broad in scope because the clinical informatics may consider the perspective of available resources with other healthcare team. For example, for nursing informatics, it will focus on the how the nurse perform assessment for the day. In nursing informatics, the nurse will record the consciousness, will record the physical examination findings, will record the care plan, will record the medications that had been administered to the patient. So more focus on the functions. While in the clinical informatics is more broad in scope because this will consider the information that will be provided. The caregivers that we're talking about is not the caregiver per se that we have known. The caregivers is certainly more on the healthcare team. For example, the in clinical informatics, all of the healthcare personnel may need an access to results of diagnostic exams. Why? Doctors will use this as a reference for their pharmacological management. Nurses may need the access to the the results of diagnostic examinations for purposes of prevention of complications. Another nutritionist may need an access to the information system or clinical informatics for purposes of preparation of appropriate diet based from diagnosis. So let's consider din po ba ang perspective of non-healthcare personnel? Yes. Since it considers pa rin the operations of the hospital as a business, the accounting department may access to the clinical informatics so that it could align the resources that had been charged, that had been identified and utilized to the patients if the patient undergone a specific procedure. So nursing informatics are more task-oriented of nurses, and clinical informatics is more on the information provided for the whole healthcare team so that it could process a more holistic care plan for the patients. Okay? If you have any questions po, feel free to use the chat box, or you may unmute yourselves if you have questions or even raise your hands. So are there any questions? Count of 1, 2, 3. Okay, hearing none. If there are no clarifications, I think the lesson is being clearly delivered to all of you, and I appreciated it. Next, let us now consider in nursing informatics and in the clinical informatics, we have the Chief Nursing Information Officer. So this is now being established in most of the healthcare institutions so that to facilitate the monitoring of the involvement of nurses, or rather in the nursing service, on the use of the IT system of the specific facility. Just like the chief nursing officer is the one that is who is responsible to monitor focus on the nursing services who are definitely nurses involved in processes. And the processes that we involved is the nurse who is involved definitely on direct patient care, the nurse who's carrying out orders of the doctors, other processes may involve the nurse who is administering medication, a nurse who is definitely and continuously updating the inventory of and stocks of the resources of the unit. That is the function of the chief nursing information officer. The the hospitals can invest an information systems platform, but the monitoring of implementation, the orientation, the training, the acquisition of the expected competencies of nurses, the responsibility comes with the chief nursing information officer. Now, what is now the difference of the task of the chief medical information officer? For the chief medical information officer, it's the same as what I have mentioned about in the clinical informatics. In the clinical informatics, it is more broad in scope because it involved more on healthcare personnel and the non-healthcare personnel. So that's why in the chief medical information officer, it considered work in both the technology and the medical areas of medicine. So it means, di ba, for the medical doctors, they do have various specializations. Medical doctors are also in charge of the case analysis of the patients. Doctors also are in charge on how they facilitate deliberation on the case of a post-operative patients. So I think the chief medical information officer can definitely facilitate on how to maximize all the healthcare personnel. Unlike the chief nursing information officer, it's more on the nursing service department. The chief medical information officer is the our stakeholder, the main stakeholder are the patient. So what is the purpose of what is the responsibility of the chief medical information officer is to exhaust all means, the access of all authorized healthcare personnel so that the use of the technology itself may benefit the patient with the access of all healthcare personnel. Next po, other than that, we have also the consideration of the nursing service and the medical. So the differences is that of in nursing service, so we have nursing informatics, we have the chief nursing information officer. So the department that is basically responsible for the implementation of the health informatics is the nursing service. So in the nursing service, I may align it with the task that I have mentioned a while ago, that the patient is rather the nurses are responsible for documentation. And what are those important processes or measures to have efficient records management? Ito po, evaluating yung tinatawag nating information technology system that are being used by the hospital. Kasi nurses are the ones who may have a higher percentage of maximizing the use of the IT system, such as electronic health records and considering the workflows that involve technology. Example, the nurse maximizes the use of the electronic health records for the access of the doctors, for the access of the nutritionists, for the access of the pharmacists. So we are connected with interdisciplinary but still the nurse is the core. Why they have considered nurses as the core in the nursing service? Because we have the highest percentage of interaction with patient's condition. That is merely one. So next, in the medical, it integrates the use of the technology into the day-to-day patient care. So it means that tayo, we are part of the medical, which means that all healthcare team may facilitate the input so that it can identify holistically the condition of the patients. So that's why on the perspective of a doctor, his physical examination findings, it may enter there also the results of the physical examination findings of the nurses so that it will facilitate the monitoring if same findings are being considered by the doctors and the nurses, and if there are some discrepancies, then this will open a venue for discussion and deliberation. So that is mainly the importance of the use of this health informatics on the medical. It's more on the holistic. On the nursing service, it is more focus driven for nurses. Next. I will now be presenting to you a video presentation before we have our break, health break, so that for you to understand some of the opportunities and careers for health informatics.
Today we are here to talk about the exciting opportunities in the field of health informatics, otherwise known as HI. You may be more familiar with the name medical records. In the past, medical records consisted of handwritten notes, x-ray and laboratory reports, and other information, all documented on paper and put together into one file, which was then put into large rooms. Whenever the need arose to review the records of a specific patient, the patient's file would be retrieved from the filing room and delivered to the requesting physician or clinician. Today, the U.S. healthcare industry is trying to implement health information technology for all providers and related businesses. This requires a new workforce with specific training in health information technology. So, what specifically is health informatics? HI is the application of information processing involving both the computer hardware and software. It deals with the storage, retrieval, sharing, and use of healthcare information, data, and knowledge, including its communication and for decision-making. Nothing in healthcare occurs without the information. For example, when we go to the doctor or the hospital, they take down certain information, such as height, weight, or blood pressure. This information often includes diagnoses of conditions we may have, as well as lab results and prescription medications. A term you might hear when people are talking about health informatics is the electronic health record, or EHR. The EHR is a real-time patient health record with access to tools that can be used to aid clinicians in decision-making using the most current knowledge available. The EHR can automate and streamline a clinician's workflow, ensuring that all clinical information is communicated when and where it is needed. So, where do health informatics employees work? They work in a variety of settings, including hospitals, ambulatory care clinics, private physician practices such as your doctor's office, skilled nursing facilities, and military MVA facilities. They also work for EHR vendors in which they help to develop, program, sell, and implement the various EHR products. Or they can work in higher education, meaning in universities and community colleges, as educators, researchers, and innovators of health informatics. What kinds of roles do health informatics workers fill? Again, many different ones. For example, at the entry level, one can choose to become an HIM clerk or medical records specialist, in which one primarily works with the patient records. Typically, the education level necessary for an entry-level role is a 2-year or associate's degree. Or they can choose an intermediate role, including supervisor or manager, data analyst, or implementation specialist. A data analyst uses statistical techniques to rearrange health information into patterns and categories that can be useful for many different purposes. An implementation specialist is someone who installs hardware or software for the healthcare organization. Usually, in order to be in an intermediate role, you need a 4-year or bachelor's degree and applicable work experience. There are even advanced career levels on the HI pathway. Some of these include a quality director, who is responsible for ensuring the organization is meeting its patient care quality goals, or a chief information officer, or CIO, leading the IT investment and implementation strategies, or a chief knowledge officer, CKO, someone who is responsible for converting data into knowledge the organization can use. Someone at this level has a bachelor's or master's degree with lots of work experience. These people really are the experts. What kinds of skills do you need for these roles? There are different categories of necessary skills, such as technical, workplace, academic, and personal effectiveness skills. For example, a technical skill would be to have some knowledge of medical terminology, to know the language of medicine and related words. Have you ever heard a doctor read your blood pressure? Usually they say something like 120/80, and you think, what does that mean? Learning medical terminology would help. It is important to keep health information private and secure. This requires the knowledge of the applicable laws and regulations. What about workplace skills? They are also necessary. Collaborating or being able to work with others is critical when you are assigned to a team and you need to finish the project together. Knowing what the different HI products do and how they can be used most effectively in a variety of settings is also vital for HIT workers. Academic skills are also important. You must be able to read and understand assignments, memos, and other deliverables given to you from your supervisors. You must also be able to write clearly and concisely, as well as think innovatively in order to produce results. Personal effectiveness skills are important. This means being able to work together as a team, effectively communicating, showing up to work on time, and proving you are dependable. And you must also be able to demonstrate adaptability during assignments or projects. So what type of education is available in Texas for health informatics? There are 2 Bachelor's of Health Information Management degree programs available in Texas. One is available at Texas State University in San Marcos and the other at Texas Southern University in Houston. Both offer campus classes where the students enter as a junior, having already completed their Texas required core classes. Texas State also offers its classes in an online format. The 4+1 program is a dual program between UT Health and other four-year universities. It is open to students pursuing an undergraduate degree in biomedical sciences, biology, nursing, mathematics, and computer science. While enrolled, the 4+1 program students will take 5 courses with the School of Biomedical Informatics that will constitute a graduate certificate in health informatics. At the conclusion of their undergraduate degree, students will have obtained both their bachelor's and the graduate certificate. Those students who wish to continue on to their master's degree will have only an additional year of classes instead of 2 years to complete a master's degree. The master's and doctoral degree programs are both available from the University of Texas Health Science Center School of Biomedical Informatics at Houston. We offer a Master's of Science in Health Informatics with a traditional and applied track and a Doctor of Philosophy degree in Health Informatics. For additional information regarding our academic programs, visit our website at SBMI.
Okay, so definitely as a disclaimer, I'm not connected to University of Texas, but I think I have utilized these resources because mainly um, it already emphasized all the basic information that are needed for a nurse to consider or complete basic requirements to acquire the necessary expected competencies if you want to be a nurse informaticist. Here in the Philippines, we do have already the course in general for the informatics, healthcare informatics. Nurses are also being encouraged to enroll in these programs, but these programs are being offered by some of the most in state universities and colleges, specifically in the University of the Philippines. So, but I'm seeing in the future that even in the bachelor's degree, we could also set a specific sub specialization if ever there could be an interest of your choice soon that it could lead to a practicum or intensive practicum and your interest in health informatics, then we will find a way on how you will be given an opportunity to immerse yourselves in healthcare informatics. But anyway, in your informatics laboratory, we have emphasized on how this health informatics will be integrated in your related learning experience for this semester. Diba? Very exciting. Now, I will maximize na po. We may not have the health breaks, but certainly I will use the last 3 slides for us to finish this topic. and so that we could maximize the remaining time for your health break, and at 7:30 we could have the asynchronous session for your self-assessment exercises. Now, when it comes to the healthcare informatics, this could considered as a potential method. If we say potential method, uh, the healthcare informatics are now being used. As what I mentioned even before, it has already been introduced in the fourth industrial revolution, as seeing the future of patients will not anymore proceed to the physical clinics and see the doctors per se in their consultations. So it happened in the last 2 years during the pandemic for the teleconsultations and the telemedicine. And I think the potential method that has been emphasized in this perspective of improving the delivery of quality healthcare is the real-time access. If you have the real-time access of those information, the real-time advices and orders of the doctor, this will give us the idea of a timely interventions to prevent or to attend to the patients who may need emergencies or who may need to prevent complications. Um, I think I have received previously a question, sir, on the informatics. If, for example, we are using the platform and application that will consider the doctor's order, is it acceptable by law? For now po, since the use of this information technology, ang very risky for us to take into consideration for the doctor's order is yun na nga, 'di ba yung telephone orders. Kaya sa telephone orders there could be chances of errors doon. Pwede by text messaging, pwedeng there could be messages that may not be received by the healthcare personnel for orders, or probably the doctors may deny that it's not the exact uh, and then the exact interpretation of the message it must be. So that's why the application itself, for example, hospital information system. Okay, the doctor has been informed that she has an emergency patient in the emergency room, and the nurse will primarily enter the baseline data. The doctor can access. The doctor can will still travel for almost 1 hour, but he can already input through that application the orders, and primarily how it could be validated kasi each doctor may have the separate individual codes, so that's why it may identify those doctors who can be validated as if the doctors came from them, to evidently shown as documentation or recording. So I think this is very important, as what I have mentioned, those that you have shared with us, yung in case of emergency, how can we access those information at our level for laymen. I think this is very important. Another example, I want you to appreciate soon when we will schedule a visit in the uh, Philippine Red Cross National, na if ever there are disasters, emergency situations that may need access to uh, emergency uh, response team. So in the use of the application of the Philippine Red Cross, you will just tap your location. You will just identify. So just typical just a typical uh, application for Grab, na it will identify the available Grab car na that will facilitate you for transport assistance. So similar yung application na yon, na for the Philippine Red Cross, those who will be registered in that application, response team nearest to your area can already facilitate yung nearest who may attend to you and respond to you. So I think that is very important kasi even though the person may not be physically present pa, but you are already guided with those person or responder who is nearest to your area. So that brings confidence to every people in the community if they are having these applications being accessed by a common layman people in the communities. So next po is we have considered the minimizing errors. Okay. The use of the electronic health records as mentioned in the audiovisual or in the video presentation as the use of computerized function to facilitate, di ba? Sabi natin, okay, we have the Data Privacy Act, so dapat it must be coded. So this is yung barcoding itself are being used to facilitate direct access na. Unlike before, you will type pa the you will type pa the link, but through the barcoding it will direct you immediately to the information system or access to the information system. Example, a patient who wish to access available doctors who are specialists of in the kidneys. So he will just scan the barcode and it will give you already the information of the doctors with specialization and their schedule. Diba? So another is we have the electronic health records that will facilitate the access for the administered medications. So this will give us the idea that the reconciliation itself that are being mentioned here of minimizing the errors is it will already identify those drugs that are being ordered by the physician, the drugs that have been administered by the nurse himself or herself, because it will identify, because the code itself will be entered into the computer and into the system. And if there are adverse reactions that the patient experience, then this will all can be accessed in one medication information package in that system. Next is another is the healthcare provider can also facilitate yung services if ever the hospital is catering mga well or sick individuals, such as the outpatient department. So the computerized healthcare provider can already set a reservation for the consultation in the outpatient department or even in the emergency room, that the doctors and the nurses can be notified immediately through the use of these platforms. Next, patient care alerts. Pag sinabi natin patient care alerts, ito yung mga tinatawag natin ng mga home care management, lalo na for the elders. If they do have the system, actually it's a digital watch na siya that is being programmed if the elderly patients will be reminded of their medications. So the nurse will definitely access on the application on a remote video call, and the alert system that is being programmed in the digital watches will consider an alert for the elderly patients. Other than that, uh, actually, even in digital watches, it can already identify vital signs. If they're already being programmed there, the normal values, it can already identify and alert the patients if there are deviations in the vital signs. So this will alert the patient to prevent complications or before the patient will be experiencing those health concerns and issues. So last but not the least, it will provide more meaningful use of the electronic health records because, as what I have mentioned, it uses and maximizes the use of the technology. It always consider the improve of quality healthcare. To what extent that it will already improve the quality of healthcare. Quality is being measured if the patients are satisfied with the services, and if the patient have achieved optimum health. And these are the measures on how the patients really being identified with the quality healthcare services that they have received. And I think the convenience itself that is brought about by the use of the healthcare informatics system, I think this is one that is now being maximized now by the healthcare institutions. Very minimal hospitals na lang are not having hospital information system. But again, I know for a fact that this will consider investment and this will consider funding. So, but if you definitely invest on this, who will benefit? Operations of the hospital, stakeholders, who are the patients. Another is the engagement. The engagement by which the doctors may have the roster of their storage of the records of the patients. Kaya that's why if they have, for example, okay, doc, we have a patient here in the emergency room. It is under your care during his consultation. The doctor can just have her passcode in the hospital information system and can review already those previous results and diagnostic examinations, and even the most recent result of the diagnostic exam can be accessed immediately by the doctors. So it's a more collaborative, it's more a collaborative task oriented performance of how we definitely sustain the quality care that we give to the patients. Another is, as what I have mentioned, it improved care coordination because this is an interprofessional collaboration. From the example that I gave you, the difference between the nursing informatics and the clinical informatics. So seemingly, a more focused, task-driven platform or tasks are being integrated in nursing informatics, while for the medical informatics, it's more on the interprofessional collaboration. So I think other than that, the other meaning that really provide that are really now provided in the use of the electronic health records is that of it may not just only benefit individuals, but basically it will improve the public health. So that's why with the results of the survey that we did in our interactive sessions, it's very true. Let us start in health informatics. Since we have already identified the challenge that health informatics or information system must be strengthened, must be strengthened in the public health. I know even at this time, we can have our advocacy. So probably we can start with the results of those survey, our advocacies to establish healthcare and information technology infrastructure in the public health to facilitate care. And one thing, as what I have mentioned to you, that soon that if you will have your research or course in the research, try to consider these topics, try to consider these challenges and translate it into research findings. So eventually that is definitely my last slide, and I will end up my recording.